It's fascinating what you said earlier in the role with Sherman James, I believe you said his name was, because you also alluded to it earlier, saying that like system change or like health improvement, there's also negative health improvement, and we don't think about that often, and it is so real, and we can think about it in a lot of the pushback that's happening and how far things are swinging now, like attack on DEI, attack on equity, all
Yeah.
those things. It's like we get these wins and they might shift the system for a little bit, but the system is like counterbalancing to try to come back to the center.
Yep.
And it like raises the point that comes in my head is like, how do we get sustained like pressure so that we are getting to that positive health improvement, positive systems change, because there are always going to be actors that are going to be trying to get back to the status quo, to get back to where things were before. And to your point, like the bigger win we get, the bigger that action is going to be on the opposite side. For example, Donald Trump.
Yep.
So that very, very interesting. And I'm definitely going to look to read a lot more about that work. So I appreciate you sharing that.
Yeah, absolutely.
Awesome. And then after your fellowship at the CDC, you became a presidential management fellow at the U.S. Department of Health and Human Services. And you also progressed while you were there to become a senior advisor for strategic management. So tell us about coming across that position and then what you do.
Yeah, so Presidential Management Fellowship, or PMF, I think for anybody who wants to work in government, I think is the best way to get into government. You come in with a cohort. So you have other young professionals or other professionals who are looking to establish long-term careers in government. You're giving leadership coaching, you're giving a mentor, but you also, and I'm not sure if this is still part of the program, but you also increase in grade series each year. So it's a 2-year fellowship. So whereas it may take someone 6 to 10 years to go up one grade series, which equates to a pay raise, you may do that in the span of a year or 2 years. And so it's an advancement of exponential scale and scope, but also it's pretty prestigious and well recognized. So, I was at CDC, was really interested in doing the PMF at CDC, but was also, maybe plotting a little bit on, how do I get to DC, right? Lived in Atlanta my whole life, ready to experience something else. So once you apply for PMF, you're granted the award, but then you have to go and apply for jobs. And so there's a pool of, I think, 400 to 500 PMF applicants, and not everyone is guaranteed to get a job. So it's kind of have to be aggressive. And so I ended up applying for a few opportunities, but what actually came inbound to me was in the Assistant Secretary's Office for Planning and Evaluation, or ASPE, which is at the department level of Health and Human Services. And so working in that role, I think was really interesting. I get to see across the department. So all of the agencies, so CDC, NIA, SAMHSA, get to work across all of those teams. In our role, we wrote the HHS strategic plan that comes out every 4 years. So we got a lot of information about what was happening within the agencies, the priorities of their work, and then collecting that into a comprehensive and cohesive document. But when we weren't writing the plan, we really worked as internal consultants. So for teams that wanted to build strategic plans, who needed better support, monitoring or evaluating their plans, who really just wanted to figure out how to structure their work better so that their teams could rely on the plan as a working document and not a document that just sits on the and so that was cool. Like, we would work on projects maybe 3 or 4 weeks at a time, and then we would be on to the next. So having those sort of engagements, I think, one, sort of just honed my, consulting skill set. So helping people craft problems, understand problems, but then, working with them to develop solutions. So I really enjoyed that work at ASPE. One of the greatest bosses I've ever had, Sarah Potter, was my boss there, who recruited me to come there, and had a really great time. I'd say I learned a lot in that position about myself. One, I think just leaving home, leaving Atlanta, moving to DC presented a challenge in a different space that I needed to navigate. But also, I was granted a lot of independence in my work that I had never had before. And she really trusted me. And I think that's what really made her a great boss. So yeah, PMF was great. 2-year program. I ended up staying federal government. I think 3 years or so to get from the. I can't even remember the time. A great experience. And again, I think PMF is the best way to get into government if you can.
So I'll be sure to link that in the show notes for anyone that's interested, or you could probably just Google it. Either way works for me.